Good afternoon, everyone. My name's Nicole. So, welcome to this session on practice management. Firstly, I would just like to thank the Eastern Melbourne Primary Health Network just for organising this session. There is quite a number of people registered. I might just give them sort of another minute or so just to join in, and then we will kick off and get started. Thanks so much, everyone, for your patience. There's still a few people joining in, but we might get started because we do have a fairly packed agenda today that we'll go through. Just as far as the go-to webinar, because there is just so many people in the session, I will sort of keep everyone's microphones muted. There is, however, a little sort of question mark box up in the top right-hand corner of that go-to webinar. Feel free to type anything at all during the session when you think of it in there. I do have that open up on a second screen so I can see that. And by all means, yeah, feel free to sort of put any questions or anything that you would like to cover in that questions, and I'll see what I can organise throughout the session. Just a side note as well, if you are having sort of any sort of audio issues, again, up in that top right hand corner, there is like a cog icon up there. You can change the audio over to be a phone call, and it will give you a number to dial in just in case there's sort of some issue with your computer audio. You can always join it that way as well. So as far as what we will be talking about today, there is a fair few things in this list, but ultimately we'll be having a look through the reporting module and particular things or reports to audit your practice. We will obviously spend a fair amount of time as far as some data quality and data cleansing and what sort of options you have within the software. Template management, how we can edit those templates. We will also go a little bit sort of advanced in the templates as well, where you can create sort of custom fields, so not just fields that you pull through from the demographic or the clinical record. You can also sort of prompt the users to sort of enter additional things that will plug into that document. So we'll go through those a little bit through patient management, which sort of hooks in a little bit to the search utility. There are a few searches where you can find duplicate patients, so you could merge those. And also, if you've got patients that haven't been to the practice for a while, we can sort of find those and essentially mark them as inactive in a bulk sort of capacity. So we'll go through all of that. BP utilities, there's a few things in there that you might need to sort of go and have a look at. We'll go through them. And then sort of the tail end is a bit more, I guess, sort of setup type things. We will sort of go through just a few things in the backups, obviously making sure that we protect ourselves that way. Emails, just how to set them up. And I will also just go through the couple of areas that you can send emails from, just so that sort of you're all aware of that. My health record, just on how sort of we can make sure that that is set up for sort of the practice, as well as what information we need in the patient, so that all sort of hooks through. And then we will go through how to sort of add new users or edit them, and also the permissions list. And then lastly, we'll have a look at the managing the appointment types in the appointment book. But ultimately, if there's anything at all that you sort of would like me to cover, if I can, if I've got sort of some spare time at the end, again, feel free to put that through that questions section. I'll see that pop up, and I'll see if I can sort of embed that throughout the training as well. So I'm just going to hop out of here. Hopefully everyone that's joining is sort of in now by the look of it. So I'm just going to jump over to best practice on my screen. There is sort of a little reactions. I know I've seen a couple of people put their hands up so far. Is sort of a reaction button as well. Can I get you either just put your hand up or even give me a thumbs up if you can see my screen okay? It's just open on the main screen. In B, it's BP. Perfect. Awesome. Cool. Thanks, everyone. Fantastic. I'll put all those down. Great. Okay, so first off, let's just have a look at some reports, and we'll sort of go through them. So I'm just going to go up to management, and obviously down to reports in here. I would typically show how we can make sure we give people permissions to reports in here, but I might just leave that to a bit later when we have a look at those users anyway. There's so many reports in here, and even a suggestion maybe is that sort of once you go through and find, maybe the half a dozen to a dozen reports that you're actually going to use, semi-regularly, the option that you do have is that you can even go and sort of, technically take your permission away for those additional reports, but it ultimately just means that you don't have all of these reports to kind of scroll through. You can just sort of shorten the list to be the ones that you're actually going to use. So that's an option if you'd like to take that one up. Firstly, let's have a look at, I guess, end of day reports. So ones that we should sort of be running from an end of day reconciliation type perspective. Obviously, the big one, daily takings report, as well as any of these reports, you would have probably been in here heaps of times already. You'll have a fairly detailed description over on the right-hand side here as to what is included in that report. But daily takings is ultimately what we will use to make sure that all the money matches, from whether it be cash or FPOS or whatever it might be for those tender methods. I'm just going to double click on that to open it up. Fairly standard parameters screen. You'll get this across all of your reports. You get to choose a date range. So I mean, daily takings, we would typically just be looking at today. I don't have a whole lot of data in my training environment, so I'm just going to leave my date, but typically you would change that to be today's date. If you've got multiple locations down here, just make sure that you are sort of selecting the correct as far as your reconciliation goes. If you're just at one location, just untick the other one. Same as your providers. If maybe you weren't looking at a particular provider and sort of what money we have taken for them, you can sort of pick and choose over here as well what you'd like to see. I'm just going to leave all mine as it is, and I'm just going to run that report. Alrighty, fairly basic information. I do have obviously a few dates in here, but underneath that date, I've got that breakdown of how we have collected that payment. So I've got cash, I've got check, I've got some credit card, direct credit, some FPOS over here. Over on the right is that total. So for this date for my Bundaberg clinic, I have taken $1,435.25, which is made up of all of these sort of sub amounts. In a perfect world, when we reconcile that FPOS terminal, we should be looking for that amount there. If for some reason that's not the case, we can then hit the plus over here on the left and do a little bit more digging and try and find that transaction that maybe wasn't recorded properly, or try and figure out, where that error has sort of come from. But ultimately, they're the numbers that we're looking at to match what is on the FPOS terminal or sitting in the till. Any of these reports as well, if they are multiple pages, you can just scroll down. This one's just one, so it's not going to do anything for me. Anytime that you do sort of have the plus or the minus, you can expand out. Plus obviously means there's more information underneath that you can see. Minusing it will just sort of collapse it all back up so we don't see everything underneath. You can print any of those reports as well that you do run. Just be mindful that what you print is exactly what you see on the screen. So if you have sort of, expanded some of this out to try and find a transaction and you do decide to print it, it will print exactly what you see on the screen here. And you can also export any of those reports again through Excel, PDF, Word. If you need to sort of, save it somewhere else as well, you've got those options. I'm just going to hop out of here. Another report that you might want to run from a bit of end of day is one of these appointment reports. So grouped by user would probably be the one that I would be running. And I'll just double click that and we'll load it up. And same thing in this parameter screen that will come up, you would choose a date range. So it would be today's date. But again, I'm just going to leave that as it is. The location, the providers, this screen is going to be the same regardless of what report you run. So just make the selection that you need to. And I'll run that one. Cool. So this report, I mean, as you know, the appointment book is quite colourful. It is sort of fairly easy to see at the end of the day, making sure that we have sort of an invoiced or paid colour or even a completed colour in your appointment book. This report, I guess, just quantifies what you would visually see in the appointment book. So again, for my practice here, I've had 61 patient appointments. In a perfect world, I should also have 61 invoices if I have invoiced all of those appointments that were booked in the appointment date. If, again, those two numbers don't quite match up, I can then go and dig a little bit further. Well, I haven't invoiced anything for Dr. Ivacure. I'm a bit slack in my practice. But you can keep expanding that through to see exactly all those patients, their status as well for those appointment books. Or at least it matches, what is in the appointment book. And then, ultimately we would have to go back to the appointment book to invoice it. But at least if we're just sort of missing one, we can then just go and make sure that we do invoice that one appointment. This report is good. What I've sort of found, and I'm just going to jump out of here for a second and going to go into my appointment book. You do also have up in the view menu, you've got uncompleted appointments here as well that you can use. And I'd probably even suggest doing this over running that appointments report, only because the report is static. You can't do anything with that information. Whereas this is essentially doing the same thing. It is showing you what appointments have not been either invoiced, paid, or completed, or did not attend if that's the case. And you've got all these buttons up the top here that you can sort of process that. So these are all my uncompleted appointments from my appointment book. I've got a start date up the top. So if you needed to backdate it just to kind of clean up your appointment book, you can do that. But it will essentially show you the same information as that report, but you can go through here, and if it is something sitting at app billing, you can go ahead and create the account from here, or you could cancel appointments, did not attend, mark as completed. And then as you process these through, this list will get shorter, and then ultimately at the end of it, you're going to have nothing left to process. So I'd probably even sort of steer you a little bit to go this way instead of running just that static report. I'll go back in there though. And then probably the third report that you may want to run from an end of day, if I scroll all the way down the bottom in here, I do have a work done by provider by date report. And there is a big, capital over here that it's obviously not a report that we would use to pay our doctors, and we'll talk about that next. But what it does do is it will show us what we've invoiced for that provider for that date period that we put in. So again, I'm just going to leave my date, but you could change it to be today's date, and I'll view my report so you can see what it looks like. So in here, I've got this is my provider, and then I've got these are all the people that they have seen, the patients that they've seen. These are the items that we have created the invoice for, and then even who we have billed it to, and it does have a total fee over there as well. But ultimately, it's making sure that we are billing the correct items to the correct payer for sort of that date period on behalf of the providers. This report, though, not particularly helpful if we have not invoiced everything yet, because we can't check that we have invoiced the correct items if we haven't invoiced them yet. So making sure that we sort of process all the invoices first, and then potentially we run this report. We could potentially run it and give it to the doctors every day, or it could even be something that you allow your providers to be able to view their own data. If you sort of want it at your practice, you've got that ability to do that. I'll hop out of there. They're probably the three that you'd be looking at doing as sort of part of an end of day reconciliation. If we talk about paying doctors, obviously you'll have sort of your own calculations on how to do that. There's a couple of different ways that practices typically pay their doctors. One would be based on the services that are invoiced, and then the second way would be that you calculate their payment based on the money that you have received for those services. We'll go through both ways, just sort of to try and make sure we cover if anyone sort of does it either way. First off, let's talk about services. So this is just what we have invoiced. It doesn't look at anything that we have received payment for. It's just simply what services we have invoiced, services that we've performed. Most of these, and there's again a few options in here, you'll probably just find one, and that will be the one that you use. And really, it's mostly that it's just changing what it looks like as far as the grouping goes. Again, if there's any report that it is not to be used, so for example, this one here is not to be used for paying providers, it will sort of very clearly say that over here on the right-hand side. Beyond that, though, you sort of can pick the one that you like based on sort of what it looks like as far as the grouping goes. But ultimately, just don't use one that says that. I might have a look at this one here. So I'll go services by account type, group by service created. We'll see what this one looks like. And again, it's going to be the same information in here. You would choose like your fortnight or your month, whatever you need that to be. Your providers, your locations, same as before. Alrighty, so we've got Dr. Ivacure here at my Bundaberg Clinic. These are all the breakdowns for that date. But really, this 4,000 over here on the right is that number that you would then use to base your calculations off of. This report is sometimes a little bit interesting as well because it does give you the breakdown of the account type. So you can sort of see how much of that is private versus Medicare versus all the other different options that you have up there. It does also give you this percentage as well, which can be curious. If you maybe have a provider that's not sure why or how they can possibly increase their payment, and maybe they're privately billing only half of the time, maybe that's something that they can look at if that's sort of applicable. But it's just a little bit interesting to sort of see the breakdown. But really, this number over here on the right hand side, that would be the number that you would plug into your calculation. Groups it obviously by the providers through there. If you do need to go and dig in a little bit deeper, again, anything that has a plus, you can expand those out and sort of keep going through if you need to. But ultimately, that number over there on the right. And then also you can see from a location or even a practice perspective, how much sort of you have invoiced in that same time period as well, which again can be a little bit curious. I'll hop out of there. So services reports, there is also like a summary version of essentially the same report. I might actually just run, oh, sorry, I'll do the same one as what I did. Let's have a look at this one. Um, it's the same number. We will get the same number regardless of whether you run the services report or a service summary report. It's just the summary that you won't be able to dig deeper into. So if you just maybe need that high level number, maybe that summary report is sufficient enough for you. If it is something that you need to give a full itemized list to the provider, then you'd probably be looking at just the standard services one, and then sort of giving them their section of that if they want to fully line by line go through everything. But if you just need high level, you've got a summary version. It gives you the same number though at the end of the day. I'll hop out of there. Just going back to that a little bit, I'll just run this one again. If you do need to give a full itemized list to the providers, there are a few other tabs in this parameters window that you can sort of go through. I'll just click into this billing one in here. Mainly, so in that scenario, we're giving them a fully itemized list. This expanding all the invoice and service rows, because by default, when you run that report, everything is collapsed up and you have to hit the pluses to expand it out. If you need it fully expanded from the get-go, you can just come in here before you run that report and actually expand all of that rows in there. So everything that had a plus in that report will be completely expanded when I run that report. You do also have a few options in here potentially, maybe if you sort of only use your calculation based on certain numbers or item numbers, or maybe you exclude maybe custom items, you've got some options in here if you don't want to include sort of all item numbers, or if you want to sort of cherry pick what information is in that report, you can make some changes in here. Maybe if you sort of aren't interested in Medicare and DVA, you could untick those and it just won't include that information when you run that report. Also, just in this configuration tab, if you were giving them a complete itemized list, that report I ran just sort of put provider under each other in one sort of page. If we were sort of running one report and then giving a few pages to each provider of their relevant pages, what you can do in here is actually set a default report grouping and change that to be the user, and then you can actually put a page break between each top level user. So what that means is, for me, all my Dr. Ivacure will take up however many pages it takes. Say it takes up 3 pages and it only goes halfway down page 3. It then puts that break in so that my next provider doesn't print on that same page, it prints on the next one, and then it sort of separates that data a little bit if we were just generating the one sort of for everyone. I'll view that one there. But again, it's all the same information, but this one will be fully expanded out. So it takes up lots of spaces through here. But if you do need that, you obviously have those options, and then you can either print it to maybe PDF or paper, or obviously you can export it as well to any of those different formats like normal. I'll hop out of there. Payments. So if you were basing those calculations on what money the practice has actually received for that provider, you would be using a payments report. And again, there's quite a few in here, but if you have a look sort of a bit closer, it's all just to do with how they're being grouped. Any that it is not wanting you to use, it will tell you over here. But all those other ones, it's going to give you the same number. It's just going to look a little bit different. So it just sort of depends. Find the one that you like. This one here typically is a bit of a go-to. It is the longest named in that list, which makes it a bit easy to remember. But yeah, group by payment created date, including related services, is the rest of that. But I'll just double click on that one so we can have a look at it. And same thing in here, put in your date range, provider's location, just like normal, but I'll just run mine. end. So basically the same sort of concept in here, except we are looking at what we have been paid. So I didn't change my date range from my services versus my payments. So I invoiced, I think, for Dr. Ivill 4,000 and something or other. But obviously in that same period of time in my training database, I've actually only collected payment for around half of that, 2,265 and 10 cents. Again, you can break it down for the days as well if you need to. And it does give you that breakdown as well through here as to private, Medicare, etc. Through there, and the little percentages as well. I'll hop out of there. Again, there's summary reports as well for that payment. Same thing as the services, it just gives you that top level number. The other report that you might want to run is there is a transaction report. It's the same numbers, but what it does is sort of puts the services and the payment report on the same piece of paper. And I'll just run it again so you can see. So on here on the left, you've got your services. So in this date period that I put in my parameter screen, this is what I have invoiced in that period of time. So there's my 4,000 there. So it's the same number that we looked at earlier. And then on the right side is the payment. Again, same period of time, but the payments that we have received. So I've only received 2,265. So there's that discrepancy. Those two numbers are the same. That's the services report number and that's the payment report number. This transaction report just puts them all on the same sheet. So you can sort of see a little bit as far as your cash flow goes up here. There is a question come through, which reports should be sent to accountants for business generated income? I'm assuming you'd probably either be looking at a payment report or possibly even this report where they can kind of see what we've invoiced, versus what we've actually been paid for. And again, you could run that report and expand all those rows out to get all those transactions, and then you can just pump it out to like an Excel spreadsheet or a PDF and send that through to your accountant. Hop out of there. So they're really the few options as far as paying the doctors go. I'm just going to cheat a little bit. I'm going to go straight up to the top and I'm just going to go through the rest of this list. They're all sort of grouped, I guess, to a degree, but I'm just going to go through a few of them that you might find useful. First up here, we've got statistic reports, and you can either do that for individual or combined locations if you are multi-location for your practice. What this report is a bit of sort of high-level KPI to a degree, but it will show us things like, how many appointments the providers are doing, how long they're spending in with patients, how long their average wait time is, things like that. So here I've got for my one location, these are my providers. This is the total number of the patient appointments, but the breakdown per provider. You've also got non-patient appointments and did not attend as well. How long they are spending in with their patients or their non-patient appointments. And again, a total over here. Average minutes per patient appointment. And then you've got an average wait time over here as well. So say potentially you run a 15-minute appointment book and maybe this particular provider, their average is 20 minutes. Maybe that's a sort of the start of a conversation as to, something more from there, whether it's that we can sort of increase their time maybe, or it just starts that conversation with that little bit of data. You can also expand them out if you want to see sort of exactly on particular days the same information. On the next page of that same report, it gives you the breakdown of the appointment types. So again, we can see how many of each appointment type we are doing across that location. And then if you expand it out, it gives you that breakdown per provider as well. So say that 20-minute provider, but they were also the one that happened to do more care plans in that period of time. you would obviously expect them to take more time than sort of standard consults. So again, it's all just data, and it just maybe potentially starts a conversation as to what that might mean sort of for your practice in the real world. But same thing over here, average appointment time and things like that over here. Beyond that, there's a few graphs and things in the rest of this report if you are a bit more of a visual learner, but really that first 2 pages with those sort of KPI statistics is sort of the way to go. I'll hop out of there. We looked at that appointments report. You do have a few banking reports through here. Again, it's all just depending on sort of how it gets grouped. But obviously, you'd probably more so be looking at banking through the banking module under management as far as that, but you've got a few reports in there as well. Cancelled and written off services. I'll just run this one. So it will show us any invoices or services that were cancelled or written off in that period of time. Again, I'd probably more so be running this as a bit of end of month, sort of throwing it into that process. It is good just to make sure that everything is sort of happening as it should be. As far as cancelling invoices go, you probably already are well aware of it, but it's only if you need to change the provider or the service date that you would actually need to cancel an invoice anyway. Beyond that, you would be adjusting that invoice if it's sort of just an item number or something else that needs to be fixed up. So if you were to run this report and maybe you had a lot of cancelled invoices or services in here, it will show you exactly, well, it shows you the item number there, but it gives you all the information in here around sort of who cancelled that particular service or invoice as well. So, and also it gives you why they typed that they cancelled that particular thing. So if you were to come in here and there's just a big long list, you'd be looking at this adjustment reason and you would be wanting your staff to be putting in an auditable reason, I guess, as to why they're doing it. And if they weren't, again, that it would start a conversation as to, that they do need to ensure their data entry is correct. But also, if it was all just the same user, maybe it is more just a training issue for them that they haven't sort of been shown exactly how to do those particular things. Maybe they just don't know that they could adjust it if it's not just the provider or the date that's wrong. Written off, obviously making sure that that is definitely what we wanted, that yes, there's some form of process around that, we've got the doctor's authorization to write that particular debt off, things like that. But I would probably be more so putting this in with your sort of end of month process. I'll hop out of there. Debtor reports, you do obviously have the debtor list as well under management. This debtors export just makes it a bit easier if you were needing to export that to like a CSV or to Excel to potentially put somewhere else. Again, probably a little bit old school. I know that technology's, probably a bit more reliable now than it used to be, but it's also not necessarily a bad idea to whichever one of these reports you like the look of the most, or even just that export one, including that as part of your end of month and putting it somewhere that's not on your BP server, so that if the worst should happen and you lost your database, you would at least know who your debtors were at the end of last month. Definitely don't have to do it. It could just be something that you might want to build into your end of month, but otherwise you do have all those different debtor reports as well that you can run. Deposits in here, if you do happen to sort of collect deposits, maybe for, I don't know, crutch hire or equipment hire or something, or I don't know, maybe a deposit before they potentially have, a bit more of an extensive procedure done. This report will show you what deposits you have taken essentially in that period of time that you put in that date range. I'll just wait for it to open up. There you go. Same thing though, put in your date range, locations, providers, all that's fine. And we'll just see what it looks like. Alrighty, so in here, so I've got a deposit here for Raymond. Again, he gave it or paid it on the 14th, and we've got all sorts of things in here. But ultimately, we've got a total over here. This is just showing us how we have taken that original deposit, and this column here is actually that we have used some of that somewhere. So we have, a deposit here for 600. We have used or allocated that against invoices, that amount here. So technically he still sort of has a fair bit of money on his account that he can use for something else. Not really something that we see very often in the GP space as far as taking deposits, but potentially if that is something that is part of your practice, this report is quite helpful as well, just to kind of see what's going on there. I'll hop out of there. If we keep going down, there is this held accounts report, but really, again, I would be looking at held accounts through held accounts in the management menu, only because you can actually do something with them from there. This is just a static report that shows you the same. That's what it is already in that list in the management menu anyway. Few online claiming reports through here, but again, you'd probably be looking at that through management online claiming because you can actually do something with that. But if you did need one of those reports, there's a few reports in there as well. There's a few sort of patient listing type reports in here. Some of that might be helpful. I would probably, again, more so be leaning towards looking at these types of things through the database search or the search utility up in utilities and search, which we will definitely be looking at today, only because in that search utility you can add some filters and do some sort of extra manipulation to it. These reports in here, you get what you get. You can't do anything, sort of more so to filter them down if you want to, but some of that could be helpful. We looked at payments reports. Practice fees, that is the same report that you can run when you're in the practice fees window and you print the fee list. It's the same one. It is not a bad idea to, if you are sort of changing your fees at any time, once you have sort of gone through and made the changes, just to print that full list out. Because I know you can look at it in that practice fees screen and sort of go through each item and then look at the right as to what it's charging. But I don't know about you guys, but my eyes get a little bit blurry after a while. So sometimes I would even print that out and actually tick it and make sure that everything is going to bill how I would like it to bill. So you've got that option there. Reversed payments and bounce checks. So I'll open this one up. So shows any payments that have been reversed, which was sort of the big one these days, not so much the bounce check part. Again, put in your date range. And in here, so it shows you sort of the provider it was for. I'll just have a look at this one in here. The date in here, the reason as to why. I'll just keep expanding that out. And I've got all that information in here. So this one here was reversed by this user here. And I'll just expand that one out. It's probably, find a cure as well. But again, there shouldn't be too many instances where we have had to completely reverse a payment. And if we do, that again, we want to be making sure that we're writing something legit or choosing something legit in here as far as if we did have to, justify why that happened. And again, if you looked in here and there's a heap of that for a particular user, that would be a conversation around, maybe they just need a bit more training or something like that from there. Again, I'd probably be sort of building this into your end of month just to sort of have a look for the last month and just sort of make sure that everything is sort of all above board. Out of there. Service reports we looked at, shared health summaries is a good one. You can just look at it sort of across the board or by provider. I do not have any real data in mind, so I won't run it. But this would be good to make sure that you are tracking okay for the quarter, to make sure that you're sort of, going to meet your number that you need to meet for that. Total vaccines provided is also a really good one. It will show you, again, for the date range, how many of a particular vaccine that sort of has been added through the software. Good from a retrospective view, as far as if you're doing like a stock take or something, making sure that it all matches up, but also for a future ordering. Say you have a look at, last flu season, how many vaccinations we did, and then you sort of use that to base your ordering for next flu season, things like that. Um, they're probably the big ones. If you haven't already, do go and sort of have a look at everything else that's in there. They're sort of the main categories anyway. And then sort of, yeah, just work out the ones that you will sort of use. And again, you'll probably get that down to about 12 or so, even those end of month ones as well. And then if you like, you can always sort of hide the rest of them because it can be a little bit confusing with how many reports are in there. But that's pretty much reporting. So I'm going to hop out of there and we might talk a little bit around some data cleansing. I'm going to open up BP Utilities, which does get installed with the software, but it is a completely separate app. So you do need to search for it, but it is just BP Utilities. And my search is always really slow on my computer, which is nice of it. And you do have to log in to it as well, but it is the same password that you would use just logging in normal. Sorry, just a question come through. Can we tease out a particular vaccine given? Adia, can you send through a little bit more info on what you mean by that? And I'll come back to that. I'll keep talking here. Just as a side note in here, if you haven't been in here before, we'll only have a look at a few, like there's heaps of stuff in here. We'll only be looking at a few things in here as far as what we would sort of typically need to use. You can potentially do a little bit of damage through here because this is sort of a bit more back end. Support might walk you through doing something in here, collecting logs, things like that. If you're sort of not sure what you're doing in here, please just call support and ask them to give you a little bit of moral support for the first time, just so that it preempts anything potentially going wrong. That's sort of probably the only sort of caveat or quote unquote warning I would say in here. There's heaps of stuff in here. If you do click on something, it will give you this sort of little description down here as far as what that means. We are going to first off though scroll pretty much down to the bottom and we're going to look at this cleanup history here. So as far as I guess good data goes, we need to be making sure that when the doctors are entering diagnoses for patients, that they are putting in the clinically coded items. And just to provide a little bit of context for that, I'll just open up a patient. So in here, when they do a diagnosis for a patient and they do a search in this list, that list that it generates here is the clinically coded list, which is what we want, especially when we're sending data externally. I'll double click on my asthma here. What sometimes happens is that doctors will then, instead of using these tick boxes here or even that provisional diagnosis here, they might put, a question mark and they'll type something up here. As soon as they do that, that item is no longer clinically coded, which means for it to be useful as far as searching and de-identified data goes, we need to do that cleanup history back in that BP utilities that we were just looking at. So, as far as education to the doctors, where we can, they need to just be double clicking on that diagnosis on the left here and just not touching that field. If they need to use a tick box, use a tick box. If they still need to write extra information, they can write a whole novel down here, and that's totally okay as long as they're not touching that field, because otherwise, we do need to come and clean it up. So, these are just items that have been sort of, I guess, touched after they've been selected. So they're not clinically coded. It is just a matter of selecting it and then coming over here and finding what it should match up to. So I don't know, for example, I'll choose this one here and then just clicking replace. It then removes it over here on the left, because this is essentially like your to-do list. If this is not something that you have looked at before, whether it be for exporting data or potentially accreditation, you know probably sit on your seat quite well when you first come here in here, because potentially there could be lots to sort of go through and clean up. And if there is, it would be sort of probably a timely reminder with your doctors just to make sure that they are, when they diagnose, double clicking on the left and then not touching that field on the right. They can use the tick boxes and the one on the bottom left if they want to type. And basically just rinse and repeat through here. I think right neck is just a spelling issue. So select the one you want to fix up, start typing. This is a clinically coded list, match it up, and then just click replace and just keep going through that list until there's nothing left to do. So I'll hop out of there. Other things in here, I'm going to just go back up the top a little bit. There's a lot of deleted ones. So as in deleted patients, deleted visits, deleted correspondence, users, contacts, and account holders. Typically we wouldn't be deleting data anyway. We would usually just be marking things as inactive where we can, especially as far as patients and things go. If someone happens to accidentally do that, you can actually come in here and essentially restore that back to the front end. So say we did have a deleted patient, I'll double click on that little sort of crystal ball. So I've got a couple in here. You can essentially just click on that and hit recover. So then when I do a patient search for Todd, he would now be visible for me to do whatever I need to do with him from there. So that's a good one to know about. Same as all these other ones, it's the same concept. If someone happens to say, oh, I accidentally deleted something or other, you can come in here, have a bit of a look, and even these visits, you can actually read it as well, which is nice to make sure it's the right one, and then just hit recover and it just pumps it back to the front end that you can have a look at. Cancelled appointments here is really similar to the cancelled appointments that you already have from the appointment book. You've got view and cancelled appointments here. It's pretty much the same. The only benefit of having or looking at cancelled appointments through here is that you can search by their surname. So this just shows a whole list. I obviously don't have any for today, but this does let you search just on that as well. Maybe could be helpful for you. Merge patient restore. We will go through how to merge a patient a little bit later. And just as a big, and if you have merged a patient already, you would have seen that big warning that it says that it can't be undone. That's sort of like it's a part truth. When you merge two patients together, it merges their it sort of just crashes out the second demographic. It sticks to the primary demographic, but it merges all their clinical data together. If that was done incorrectly, like it ended up being not the right people that we wanted to merge, when we do this merge patient restore, it separates their demographic back out again to be those two separate records, but all of the clinical information will still be in that merged state. So it'd actually be a matter of kind of then going and manually shifting across anything that needs to go back. So whilst it sort of can be undone, it is really important to make sure that when you are merging patients, that you do a little bit sort of due diligence to make sure that you're merging the correct records together. I don't think there's probably anything else in here that you would probably need to come in here for. Again, there's just a lot of extra stuff, more from a support perspective. They might need you to come in here and sort of do something for them, or they'll remote on and sort of walk through something with you. They're the only ones that I would sort of be happy enough touching without sort of some hand holding from support. So I'm just going to hop out of here now. Still thinking from a bit of a data cleanup lens. I'm just going to go into setup and configuration, and I'm going to come down to reminders in here. I've just got a few things coming through the chat, but I think I'll come back and read them in a second. Reminders in here, so you can customize this list. So this is the list that your providers will see when they create a new clinical reminder. Ultimately, they should be choosing something from the list. That's sort of what we want. And you can, if they're needing a new reminder for something or other, just click on add and add that new reminder, so they can then in the future select that from the list instead of having to potentially type something in. So give it a name, and then basically whatever the default interval is for that reminder. And again, it's a default interval. They can still change it to be what they need for that particular patient. Where you would possibly need to do a bit of a cleanup in here is if they are not picking something from the list. And I guess just on that note, as far as picking something from the list, there is this little tick box down here. So allow free text reminders. What that means is if they don't choose something from the list, they are quite welcome to type their own reminder in, and it lets them do that. If you really wanted to crack it down, you could actually untick it, which means they don't have the option to type anymore. They have to pick something from the list. So we would be getting really good buy-in from them that that list is exactly what they want. I've only heard of a few practices through training that have been game enough to sort of untick that, but you do have that option if you need to force them into choosing something from that list. From there, if they do sort of just, if we do allow them to type their own, we would just need to come in here and do a little bit of a cleanup. So I'll just click on that cleanup. This left-hand side is what they have typed. The right-hand side is our reminder reasons that we have in our list. So again, even if they type exactly the same reason as what we have in the list, the software is not smart enough to recognize that it's the same thing, so it won't kind of match them together. What this screen is doing here is this is what they've typed, and we need to pick on the right what it matches up to so it all sort of links through properly. So for example, if I selected, I don't know, those two as an example, that's what people have typed, and I just held down my control key to let me sort of pick or choose random ones as well, just as a side tip. But over here on the right, I would be matching that up to, probably this one here. So I'll just click on change. Are you sure that you want to change it? Yes, I am. In a perfect world, my data's a little bit broken in my training database, but similar to those fixing up the coded items, this list will get shorter as you match them up, and you just keep rinsing and repeating that left-hand side until you don't have anything left that you need to match up. If you are allowing the providers to sort of type their own reminder, I would probably, include this cleanup reminder I don't know, maybe every month or something, just to kind of keep on top of it. And again, if this is not something you've had a look at, it might be a little bit crazy when you first have a look in there as well. But yeah, just work your way through. Um, Other things from a cleaning up perspective, immunisation batches. So in this setup menu, again, there is immunisation batches in here. So the providers and the nurses have the ability that they can add batches on the fly when they're giving an immunisation, or when they're adding it to the software, but they can't delete sort of out of that list through the clinical record. What it would be is coming in here, and I guess this is sort of twofold as well. You can just allow them to add those vaccinations sort of on the fly, or say if you got a new shipment in, and I'll just pick this one as an example, you can come in here and actually add the batch information. So, I don't know, whatever it might be, and the expiry date for it. That would then be in the drop down for them when they're going and adding an immunisation through. Um, you could do it that way, or you could just sort of let them add it as they need to. As far as when things expire or potentially you've used up all of that batch, you would sort of want to be coming in here and essentially just deleting it from the list, because it just then means that they don't have it in the drop down to accidentally choose from in that immunisation screen. They would have to at least be keying it in to start with. So that might be something that you can sort of build into your workflow somewhere as well. I'm just going to go back and reread a couple of things through the question chat. Margaret, how do I activate e-prescribing in BP? I will quickly show you that now because we probably won't circle back to it. E-scripts is a little bit of a thing, and actually I'll put a note. We did a Be in the Know a couple of months ago now, specifically on how to set up ERX, which is sort of the background for eScripts, and also some troubleshooting steps if it is not quite working straight off the bat. I will actually put that in the follow-up email to this so you can have a look at that. But ultimately, once ERX is set up, as far as turning it on in the software is really just a matter of setup and configuration and enable e-prescriptions here. That tick box and basically saving it. As long as a user, like that provider, has their health provider identifier in their user setting, and that ERX is set up correctly, which is sometimes definitely a lot more difficult than hitting a tick box in here, it should just sort of work after that. Adia, we do all childhood vaccines, but if I just want to know how many Fluavax were given last year to place my order, not really. I know that was the follow-on from that other question that you asked. Just going back to, I'll show you just super quickly what it looks like. Sorta is probably the answer to that, as in it gives you like a top level number. I'll just view that one. I don't know what I've got. I've got hopefully a couple in mind. But it just gives you for that location, and it just gives you that vaccine name and that you gave X number. I obviously haven't done very much. You'll have more in yours. It does then break it down if you really wanted to and tells you specifically the patients, but you would sort of need to, if you were maybe just looking for the kids or something like that, you'd have to do a bit of manual manipulation with that. But this would at least tell you high level how many of that vaccine has been added through. Merging patient files or records from other clinics makes my records go so bizarre that I can't even recognize my own patients anymore by looking at the file. That's interesting. Is that when you import them, and are you using the external import export like utility to do that, Adia? I'll come back to that. Oh, yep. So, I mean, it shouldn't. And if that does happen, I would probably just point you towards getting support to have a look at that, because that's not how it should work in a perfect world. If you do end up getting another file that you need to import from somewhere else, maybe even just before you do it, just have contact support and get them to maybe have a bit of a look as you're doing it, just so they can see what you're doing, and also sort of what that bizarreness is happening after the fact. I know that's not ideal, but sometimes we just need to see things happen to try and work out what's going on, because that's not what should happen. Jackie, what is enable service registration assistance? Let me go back to that screen. Service. That is an awesome question. I have no idea, which means it's obviously not something maybe that we even use anymore. But I will write a note for you and find out, because that's always curious. There are the few odd things throughout here that are legacy things that just don't get used as technology has advanced. But I'll definitely find out an answer for you, Jackie, and I'll put that in the follow-up email as well. Margaret's unable. ERX is ticked. I get a message provider isn't configured with a prescription exchange service. I would say that that's an ERX issue. So Margaret, probably what I would recommend for you would be, I will send through the ERX webinar that we ran. It goes through setup from the very beginning and the ERX setup, not sort of ticking that tick box. Follow that through, and there's a few then troubleshooting steps in that. Beyond that though, again, just call support. They probably hate me saying this, but that is what they're there for, and it's easier if we try and fix things as we go through. But Margaret, I'll send you through that link. Watch it first, though, if you can, and get it to a point, because then if you do need to call support after that, you can sort of let them know what you've done already, and then they'll troubleshoot it from there. Perfect, no worries. I'll hop out of there. Sorry, I'm just going back to my list of things to make sure we talk about, but thank you so much for putting those questions in. That's awesome. So feel free to keep putting those through. We look at BP utilities. Let's have a look at the search utility. I really enjoy the search utility. Hopefully you've had some time to sort of look at it before now. If you haven't, hopefully it's really useful for you. So up in this utilities menu, it's just the first one here, so search. Think of it as, I guess, it's a database search, and this looks a little bit scary because this is the language that the database is written in, which is sort of pseudo-English to a degree. You are not by any means expected to learn how to write SQL, which is that language, to be able to use this tool. So sort of don't freak out too much just by looking at how it's sort of all structured through here. It is designed to be sort of fairly easy for you to, well, to a degree, easy for you to create your own searches for particular things, and more so from a clinical perspective. You can't really do any searches for billing and stuff, because obviously you've got some reports for that. But definitely from a clinical perspective, you can do some really cool things in here. This by default will show me all of my active patients. So it's pulling my patients where they are active, and it will order them by their surname and then their first name. To run that query, there's just the run query over here on the right. So this for me is all of my active patients. You might want to filter that then a bit further to, and you've got all these buttons that you can go into. So, demographics, if they're on a particular medication, if they have a particular condition, if they've come in the last 6 months to see a provider, if they've had an immunization done, screening, some observations, maybe you, I don't know, maybe you had actually, what observations are in here? Maybe you, I don't know, we're doing like a weight loss seminar or something, and you wanted to sort of, marketing sort of target, your patients that have a particular BMI, as an example. what you could do in here is actually, and I don't know how well this will actually work in my training environment because I don't know how much data I've got for these people. But we could do BMI that was over, say, I don't know what I've got. I'm just going to put 20. I'll see what happens. Click this ad. That's probably the only tricky thing, is making sure that you do click the ad. It then goes and puts it in SQL language, which basically just don't look at it because it's very confusing. But hit OK and then run that query again. Oh, yeah, cool. So these are my active patients that have a BMI of over 20. So not including 20, but it would be 21 or higher. What you can then do with that list is, if you come up to file, you can then do like a mail merge. So if you've got like BP comms set up as well, you could send anyone that has consent, you could send them an SMS of, hey, this conference is happening, please attend, whatever it might be. You could also have a letter that you've written up in the templates in the word processor, and you sort of generate them a unique letter that you then sort of send out to them some way. But generating that list first, and then you can sort of do something with that list from there. But there's heaps of stuff. Like if you're looking for people who are a particular age or in a particular postcode, if they, maybe you want to target, the asthmatics of your patients, for, I don't know, whatever that you're looking for. There's some really cool things that you can do through here. You also don't have to completely create all your own. And yeah, Adia, that's a good one. So if correct coding is not used, then conditions tab becomes useless, 100%. So that asthmatic one, if we didn't record asthma correctly, it means that we are not picking up those people. So even if you use this as a bit of a, I don't know, proactive, like again, people of certain ages with certain conditions, and we're trying to get them in for, health assessments or care plans or whatever it might be. But yeah, that is one of the other reasons why it's really important that we get that clinically coded sorted. But yeah, you don't have to completely create all of your queries from scratch. There's also a lot of queries that are supplied for you, that get installed with the software. So if I do just come up to load query here, and you're not expected to remember where this is, I will send this in the follow-up email as well. But where BP is installed, which typically is in C drive, program files, best practice software, and BPS is the folder of the software. In here, there's a supplied queries subfolder. And in there's these 4 that you can sort of choose from depending on what you're looking for. So like clinical, people of particular genders and ages, certain visits, and if they don't have particular observations recorded, patients 75 or over who've never had a health assessment done, all sorts of stuff in here that has been generated over time, that you definitely can make use of. A couple through here, patients with, I think it's this one that we want to run, patients with no allergies or nil known recorded. This is huge for accreditation, which again, just to provide a smidge of context, this is talking about allergies in a patient, and either they should be recording a reaction if they know that the patient has one, or if they don't know of any, they should at least be ticking that box there and saving it, sort of either or. What this search does though is it will tell you it'll generate a list of patients where that has not been done. So then, someone clinically can go through and, record them if they have any, or go and say that we don't have any known for that particular patient. So that's a really handy one to know about. But other ones in there, demographics, patients with all sorts of whatever it might be through there. You've also got some management ones, which is more, there's a little bit of billing in here, but you would just sort of have to go through and have a look. If you haven't been through these, I would really recommend just going and having a look as to what information you can pull, from the software as well. And yep, in the question, Proda is good for such things as well, especially with generated reports. Yeah, absolutely. So yeah, this is obviously just looking at the software, but absolutely Proda is great too. I think it was demographic, there is this one here. So active patients who have not had a visit in the last 12 months and have no future appointments, and they also haven't been created in the last 6 months. So they're not technically a new patient as such. This one is good for like a bulk marking them as inactive. So I'm actually going to load that query. It looks a little bit scary. It's a lot more involved than what we were looking at before. But again, don't like you're not expected to be able to read this. We're not programmers, and that's okay. So don't worry too much about that. But I think now it's more that if patients haven't been for 2 years, that we would be marking them as inactive. So what you probably want to do with this one is load that query. And in here, it's got number of months since the patient's last visit. So it says 12. I'm going to change that to 24. And I'm going to run that query. So this is the list of all of the patients who have not had a visit in the last 2 years, 24 months. So in theory, these would be the patients that I would want to go ahead and mark as inactive, just to kind of, I mean, inactive, we can always go back in and mark them active again if they do come back, but it will speed up your searches a little bit as far as finding your current patients. The quick way in here to mark all of these as inactive is up in File. There's a whole little option there of mark as inactive. It will then say that all patients in this list will be marked as inactive. Are you sure? At this point, you would say yes. I am going to say no though, because that will pretty much be all of my patients in my training database. But you would say yes, and it would then exactly tell you how many patients that it has marked as inactive. So I don't know, it would have been 20 or 30 through there. If you were then, I guess, to run that query again, it should, in theory, just be blank because they've already been marked as inactive before now. Jackie, how can I get a complete list of duplicate patients that are both active and non-active? That's a good question. What was the rest of that? We had a doctor transfer his records to our clinic and we have duplicate patients from both clinics and I want to merge them. I can only get a report for one at a time. What do you mean by I can only get a report for one at a time? Do you run it through here? Sorry, I'll wait for that question. But while you're getting back to me, yeah, cool. So do you load, there is one in, maybe it's in, there is a duplicate patients one. Is it in management or is it back in demographic? Visits. No, it must be in demographic. Oh, there it is. I just couldn't even see it for looking. I can only get duplicate active. Oh, I see. Active or inactive. I don't know if this will work, Jackie. I'm willing to go on a little bit of an adventure though, if you are. Let me pick, let's go matching surname and first name. Oops, I'll load that up. So if I run that query, obviously I've got a few which we will go and have a look how to merge them in a second. I wonder though if I just get rid of that line. I don't know. I don't know if I have any duplicates that are not. Oh, that's a bit rude of it, isn't it? Incorrect syntax near the keyword. And what if I do get rid of that and, oh, actually, let me put that back. Oh, that wasn't. Hang on, let me load that again. What exactly did that say? Where status is where. I'm just going to try something, Jackie. I don't know if this will work, but I'm going to get rid of that and that. See if it whinges at me. I don't know if that will work for you, Jackie. I'd be pretty keen if you can try it. And I left the where, but I got rid of the rest of that and the and on the next line, but just left the rest of that there. Because in theory, that where that patient status is active, it shouldn't even be looking at whether they're active or not anymore because we took that little bit out. I'd be pretty keen if you can in the next 45 minutes give that a crack and see if you get a longer list. I just don't have any inactive people to go and have a look at. But if you have a chance, I'm pretty keen if you chuck that in the question. But I think that should work. Just going back here, John, can you run a query for Neil face-to-face in the last 12 months as well? That's a really good question. Let's just have a little looky look in here. Non-visit. You could possibly do. I might, Joe, I'm going to get back to you on that one because there is a whole part of the knowledge base around like my Medicare and all that sort of stuff, but there's a few queries in there that it has. I will just sidebar that for now. And I'll just go and have a look at that because I think there is, but I also don't want to give you false hope either, and I just don't exactly know where it is off the top of my head. So, Joan, around that face-to-face or no face-to-face visits in the last 12 months, leave that with me. I think there is, but not 100%. I'll put that in the follow-up if I can't think of something in the next 40 minutes. Jackie, can you copy that script for me, please? Yes, I can. Actually, I wonder if I can reply that to you. I'll copy that in here. I think that comes back through the questions, Jackie, but if you can give that a crack. Speaking of duplicate patients, this will give us a list of patients who have duplicate records. I obviously want to go and clean them up. I'm going to go and just have a look at Georgie in my patient list. Callista. So here's my two Georgies. I mean, they look super similar from here. I mean, the only difference there is obviously our patient ID and that record number there. But I probably need to go into both of them to see which one is the one that you want to keep because that's the one we want to start with. I'm just going to go into the top one first. So the key fields in here that you would be looking at are the ones down the bottom. So the created by, well, not necessarily by, but on that date there, and also when the record was last updated. So this one created back in 2018 has not been updated since. Okay, righto, I'll go and have a look at the other one. This one was created earlier, so 2013 was updated in July 2018. Was that earlier than this one? What was this one? Yeah, so that one's earlier. So this one has been more recently updated than the first one. So this is probably the one that I want to keep. So I'm actually going to go back into this one. You don't necessarily have to do this step, but I find that it makes it a lot easier to then pick the duplicate one when we go through the merging process. And remembering that obviously it's so important that we pick the right one at the right time. I actually just come in here and either, in a name, basically say that this is the one that I'm keeping. So I've worked out that this is the one that's right, that's got the most up-to-date information. It's the main record essentially. The other one is the secondary one that I'm going to merge. So in here I'm going to save it. So yep, I do get that slightly different name. So as far as merging those two records together, the first step is finding the main one or the primary one, and that's the one that we want to select when we start. And then we just want to come up to this edit menu, and I've got merge. So I'll click on that. This is when it gives us that really hard worded, we need to be sure because it can't be undone, which we now know sort of can be undone, but not 100% undone. But it is still really important that we just try and get it right first off, like first go, essentially. So are we sure we want to continue? Yes, I am. So select the patient that we are then going to merge with. See now, because I changed the name, it's a lot easier because otherwise you've got to, like if you had all of that exact same information in here, how would you ever pick which one was the second one? So that's why I put the little keep in there, or you could put a symbol, whatever. Obviously we're going to go take it out, so it doesn't really matter. But then I'll pick that secondary one. You will get this little message, but it is just saying that, hey, now their name doesn't match because it doesn't, because I put that keep word in there. Yeah, I mean, Addie, yeah, but you are right that, potentially well, in here you don't even see that record number, but there could potentially be a little bit of difference in there that you could see. But like for me here, that's all exactly the same information. And if I didn't change that name, how would I know what it is? So I'm going to pick that one that I'm going to merge it with. Patient merge, yep, I sure, yep, that's fine. And then it's done the merge. So that secondary record does not exist anymore. And if we were to rerun that duplicate query, that patient's now gone. So I would then go and obviously fix up Ruben, fix up Eliza as well. But that is how you would merge those patients. That's interesting, Jackie. Does it do that before, or is it right before that, if that makes any sense? Same name but different date of birth. I wonder, just as a sort of, sorry, a little sidebar, certificate matching, maybe if we did this one instead. And if I take that out, I wonder. I'll send this one to you, Jackie. I'll just see. It's a slightly different query. It's based on their date of birth and their name, but I still just took out the whole inactive thing, if you can give that a crack. What else is back in this questions? Taruni, is there a way to search how many times a patient has been seen in the last 12 months? You can, if I just start from scratch. So I'm just going to go new query here. We can go visits seen by, let's just say everyone, but possibly, yeah, that's probably okay. You should be able to go back to, like this time last year or whatever dates that you want to put in there. And I'll just see. See, that's hard for me to tell because I don't have like proper data in for me. But that's not going to tell you how many times they have seen us, just that they have seen us. Leave that one with me. I don't, just have a quick look in here. I don't think there's a query that will give you a number. Oh, that's less than 3 visits, but not exactly what we want. Leave that one with me as well. I'll just have a little bit of a play after this session. I don't think there's going to be a query that will, say this patient has come this many times. I don't think we can generate that from the software. You could potentially look at one of our partners. Maybe like Cubico might have a bit more easier reporting like that, maybe. Leave it with me though, but that might be more so one of our partners that sort of extract the data and do a whole heap of manipulation to it, because I don't think we can generate how many times that they have been seen in a period of time. I will double check that though, but I just don't think so. Oh, Jackie, that one worked. Cool. Awesome. Just going back to my list of things to talk about. Again, thank you everyone for putting those questions through. Please keep them coming. I think that's pretty much all sort of more the, I guess, the data-y sort of topics. We're sort of venturing a bit more into, I guess, setup and config to a degree. Let me hop out of here. So the first thing I had on my list was just to have a little bit of a look at the backup situation. So in setup and configuration, if I scroll down in here, there is a BP service icon in here. It's little cogs together like a machine. And in here is where we would be turning on the automated backups. Um, it does have that little star next to it, and that's basically saying that this would need to be done on the database server. So it's not something you can do on your PC. You need to be on the server to sort of set this up if it's not already set up. Because what it does is it uses a particular service on the server to essentially kick off that backup every night or whenever you run it. That's why it needs to be set up on the server. But if we were on the server, hypothetically, I can click that and then configure the backup for it. And I would be saying, yes, I want to schedule that backup. This is where you would choose where you want that backup to live. And, potentially you put it somewhere temporarily, and then, it gets copied somewhere else as sort of the secondary backup. I mean, this is more of an IT thing anyway, but just so you've got a little bit of understanding of it. But they would be choosing where that backup goes. In here, we would be adding how often we want to do it. So do we want to do it every day, all the weekdays on a particular day? Maybe on some days we run it at different times. So, you'd have to do a Monday to Friday type situation. I'll just leave that as it is. Whatever time that you want it to start that backup. And then obviously it does pull that through to be that same path, but you could potentially change that in there if you needed it to. Compressed means that it will put it in a compressed format, which in theory takes up less space, but it does need to essentially have a fair bit of space to work with when we do a compressed backup, because it will back up the whole database essentially first in its entirety, and then have to convert that to a compressed file, which just takes up a little bit of space, but it is what it is. With that time as well, just being mindful that obviously you do want to do it after hours, because it will slow down that server whilst it's backing up. So that's not something that you want to do during your, standard working hours. And if you do potentially have different hours on different days, that's when you would more so be going, okay, well, Monday we could run it at 6, but maybe on a Tuesday you're still working at 6. So maybe you have it at a different time. you can kind of do what you need to do through here. But just make sure it is after. And then if that location is then getting backed up somewhere else, to the cloud, to a drive, whatever your backup situation is, obviously making sure that it is where it should be before that next step is taken. But again, that's probably a bit more of an IT conversation. Sending a message if the backup fails. Um, I'd probably, if you don't have this turned on now, and obviously you've just kind of left this with IT to do, I would be coming in here and getting it to at least send you a message if it doesn't work. And it could be a multiple people, if you've got a few people that potentially could be responsible for it, to get good coverage. It just is just going to send you a little internal message if it fails. So if you get no message, it was successful. If you get a message, it means that that backup last night or whenever did not work, which obviously you would then raise with IT to try and get that fixed. But if you don't have that sort of turned on at the moment, I'd probably definitely be turning that on. I'll hop out of there. Emails. Just whilst we're in this screen, as far as setting emails up, it is nearly back up the top. You've got your little @ symbol here. So this bit here, this outgoing mail SMTP server, this is what we would need to add to so that we have the ability to send emails out of the software. Again, we're venturing a little bit more into sort of IT space. But ultimately, we would click on add in here. This is relatively new. I think it actually even was in SP2, which is the version I've got now, where you can actually sign in with Microsoft and sign in with Google. Whereas before you sort of just had the server name and your credentials that you sort of put in. But if you don't know any of this, that's totally okay. Just talk to your IT because they will know that information for you. What that will then do is give you that ability to externally email from within the software. BP will never receive any email, like it's not like Outlook where it will also get if people reply or anything like that. It's purely just sending out from the software. And as far as sending out, and you've probably stumbled across it anyway, but it's again not like Outlook where you get to actually, type in an address as to, oh, sorry, you put in the address, but you don't get to type like a body of, hey, such and such, this is the something or other that you asked for, whatever it might be. You don't get to do any of that. It basically just attaches a document as a PDF to an email, and that's what they get. This field here, again, is it's not new anymore. It's been there, I think, since at least Orchid or Orchid SP1, so it's been there for probably over a year now. But you can put in a text that goes in the body of every email that you send out. And this is a good one to make sure that you put maybe like your privacy policy in here, so that if someone ever were to receive something that was not meant for them, you've got your privacy policy that's something along the lines of basically, if this is not for you, get rid of it type thing. You might also put in there, that this is a non-monitored email or whatever, and if they have any questions, here's the practice number, call us. Something to that effect. If you are potentially allowing people to email from the word processor, and we can also email invoices and receipts, but there's a preference where you can put a PIN, like a code on that PDF document. If that is something that you were using, it might even be something in here that you would say that, if you receive a document that is PIN protected, the PIN by default for everything is the patient's day, month of their date of birth. So you could put that little message in here that just goes out on everything as well, if you wanted to. This, though, is slightly new. Again, I think it was either I think it was possibly SP1 of Orchid that it came in. So you can put, and I'm not going to explain it very well. I'll put a knowledge base article in the follow-up email because it's really well documented on the knowledge base. But you can put HTML in here. And I guess in layman term for that is that, say if you had like a link to your website or like a booking system or something like that, and you wanted to put that link in here, that HTML would allow you to put a link in that the patient could then click on and it loads up. I will send the knowledge base for that because yeah, it's a little bit of coding, but it is very well documented. Um, Sorry, Addie, I was just reading your question. Some patients are using practice email and sending messages like do my script and referral and print my last. I find this very stressful and disruptive. How are we going to generate income if we keep adjusting all this? Is there a way to put a halt to it? As in, do you mean that patients are emailing you and asking you to do stuff? Or sorry, Addie, I don't 100% understand. Oh, so but as in you're getting that email through to like your Outlook or Gmail or whatever that people are asking you to do things via email? Is that what you mean? Yeah, through your reception. Um, I mean, I don't think you can stop people from trying to email you and get you to do things like printing scripts and blah, 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 blah. Um, I know, and again, there's probably a lot more people in this group that have far more experience on that front than I. But I do know that some practices will put like an auto reply on their email, which is obviously nothing to do with BP. But you can do like an auto response that could be basically something like, whether it's you're just letting them know that basically that this is a not monitored, but if they are wanting anything, basically they need to call. I don't know exactly what wording you would use there. That might be a little sidebar for sort of your group there. Someone would have a really awesome sentence or few sentences that they would set up as an auto reply. That is pretty much, it's not okay to be asking us to do those things via email. If you want it, you need to call and book an appointment or whatever it might be. But you can definitely have a chat to your IT because you can definitely set up an auto reply through your email, nothing to do with BP, but through your email. And you could put a phrase of whatever it might be that essentially we can't accept any requests for blah 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 via email. Please call us on this number to arrange an appointment, something along those lines. But that might be a good little sidebar for your group to have a bit of a chat about anyway. Because you're 100% right, and people will use that if they think they can get a response and get what they want out of it as well. And you can't control them, but you can obviously set that boundary as to what you are willing to, accept and do when people email you. Sorry, we digressed a little bit there. I'm just going to hop out of there. So places that you can email from just super quickly, you do have the word processor here. Once you set up that SMTP or IT sets it up for us, you will get the @ symbol there, in which case you can put in their email address. If I was prompting this or loading this up from a patient file, I would have I could use their patient email. Obviously, I've just created this from the main screen, so it's a little bit different. The subject here, if they are sending something that they've based off a letter that they like a template, they can come in here and actually put, or they can change that name as well, but by default it'll be the template name and then the patient name. This tick box here is a user preference. So just in there, we can tick that. The preference is whether it's ticked or not. But if I again were opening this from a patient record, that would be the patient's day, month of their date of birth. But unless you put something in that outgoing email, they're never going to know what that PIN is unless you specifically tell them what that is. Because you can't type anything in the email in here. You can also email invoices and receipts. So I'm just gonna jump into someone. Hopefully Bonnie's got something in here. So anything that's unpaid in here, you basically just select that line and then you can email them a copy of their invoice. And it's probably not something you want to pin on, but you can have a pin, but send that through. If you wanted to send a copy of a receipt, um, something that's paid in here, you do need to show the payment to get the receipt. So you'd find the purple line and then select that and click on email. And same thing in here, whether you want that tick box or not. There is definitely enhancement requests because emailing is, I think it came in an orchid as well. It's sort of semi-new. There is definitely enhancement to try and make that a bit more easier to do because it's a little bit clunky, but you can do that at the moment. Just with where that user preference is, if we just jump into user preferences, it's on the first page all the way at the bottom. So that one there. So potentially, if your receptionists were emailing invoices and receipts, things like that, you might want to turn that off for them. But potentially, if you, let's say, the providers email things from the word processor, you would probably want to leave that on for them. Good question. Can we email more than one invoice at a time? I don't think so. Let's try that. No, because you can't select more than one in here. So you have to do them separately, which is a little bit of a pain. But I mean, the other option is you would still have to be sort of printing it to PDF and then chucking it in Outlook anyway, so either or. But no, that's a good one. And actually, I might put that in as part of that enhancement request as well, because that would be handy to be able to to send multiple invoices at once. I'll just write that down. Sometime private, yeah, absolutely. Joan, I'm just gonna not read yours for a second, but I will come back and read yours in a little bit. Let's talk templates and then we'll go through the user setup and just the appointment types and a little bit on my health record as well. But in the word processor, oh, Jackie, the thorn in my side, your question. Can we also have an account holder email to come into this screen? That is 100, no, that's, that's okay. That is 100% already an enhancement request. I'll just go chuck a little vote on it. But as just a FYI, if you were to, because there's no reason why your account holders have to be account holders. You can actually set your account holders up as contacts. And if you set them as a contact, their email address flows through to that screen. Just as a complete side note, it is definitely an enhancement request, but the workaround would be potentially if you wanted to, you could add those account holders as contacts and then that email address will seamlessly filter through. Um, And Cam, I'll come back to your question as well. Just going back to the templates, I'll just spend a little bit of time in here as far as editing templates if you need to. Yeah, I agree that the contact list should be contacts and not account holders, but I'll go and put a vote on that enhancement request. Hopefully it's something easy they can fix up. So templates, you've got sort of two things in here that you would edit. One is the letterhead, which typically you just kind of set up at the start and don't really need to come back in here. But you can have different letterheads. So you can have a letterhead for the practice. You can have a letterhead for locations if you're multi-location. And you can also have a letterhead for each user if you wanted to go to all of that length, you can do all of those things. I'm just going to edit this one briefly. You can ultimately get this to look however you want it to look. You can put a heading, you can put their contact, whatever you need to do in here. You can obviously put a logo as well. The only little sort of asterisk I'd put next to a logo is just make sure that that picture is not a super high sized picture, like it's not super high resolution, only because every single document that gets generated with that letterhead, it will store it individually in the database. So say if that image was, a meg in size or something, every single document you generate will be at least 1 megabyte in size, which will exponentially grow your database, and IT will be super unhappy super quickly. It's okay to put a picture in there. Just make sure that you can't, scroll it out to, 1% and still see the grout in the building, as an example. Um, Editing templates themselves, obviously you've got templates and edit template. There are a heap of supplied ones within the software, and even if you use them as a bit of a base and then kind of modify them as you need to, and also, I believe that some of the PHNs will also have documents that you can get off them and import. Just as a side note as well, if you do get a document, either potentially from a PHN or even from another practice that's using BP, you can import those templates just under import. Templates and import template here. The same as if you were working with like a sister practice and they're like, oh, I really like that template. Can I please have a copy? And that's, all above board. You can export that template and give that copy to them as well. Ultimately, anything that's in an RTF format, so rich text format, you can import in here. And rich text, you would be able to look at it through Word, but it does need to be an RTF format for you to be able to import it. Sorry, just going back to editing. I'm just going to pick up, as an example, my specialist referral here, and we'll make some changes to it. Any of those fields that you see with the triangulary brackets is just meaning that that is pulling from a field over here on the left. And this is sort of very, I guess, traditional old school mail mergey, like through Word, that sort of thing. It's the same kind of concept. These are the fields from the database that you can use. You basically just need to put your cursor where you want them to go, double click on the field, and then when people use or merge that document, it's going to go and collect all the right information and put it in the right spot, in theory. The different groups over here that you can use as well. So general has sort of practice information, today's date, that sort of thing. There's a whole little letterhead one. This is important, just going back to when you were creating your letterheads initially. Remember I said you can have a practice location or a user or a combination of all of the above. It is just then important that when you create your templates for your documents, that you then pick the right letterhead for that document that you want to use. That's probably the only, slightly tricky thing. Some location information, heaps of other little bits and pieces, but ultimately patient, think the patient demographic. Clinical is information from the clinical record. So they're going to be mostly where you pull from. If you say wanted to insert, I don't know, their smoking history as an example, put your cursor where you want it to go, smoking history here, and that's the database field for it, so that when a provider actually loads up this document, it will then essentially pull through that smoking history there and load that through from the patient clinical record. You can't really put it in, well, you can put it in here, but it's more so for the providers. When they're generating a document, if it's, say, a referral letter, once they've kind of generated it, they can use this, where is it, investigation reports here. What that will do is it will allow them to insert results into the letter. So say they are referring to a specialist and they want to put like a little bit of their blood test or something in there as part of that letter. When they are generating that document, if they use that investigation reports, it'll then let them choose one or multiple results. And once it's in here, it is just text. So say they wanted like half of the report, not the whole report, they'd insert the whole report and then just delete the text that they didn't want, because it is just text once it gets in here. I said that we're going to have a look at these custom fields, which we will still do. So part of this template, they're all stuff from the database, that's all fine. But you can also put in your own custom fields. And these are the options that you have in here. So you've got a short text, you've got a long text, you've got numeric, you've got list, you've got drop down, you've got date, logical, checkbox. Short text, I think, is about 250 characters, but ultimately think like a sentence. Long text beyond that, so think like a paragraph, numeric, a number. List is if more so if you were going to choose multiple things. A drop down is a drop down, a date is a date. Logical and checkbox are super similar but different. They both present as a tick box, but logical will change it to be a yes or no, depending whether they ticked it or didn't tick it. Checkbox will leave it as a checkbox in the final document. So just say, for example, I might do a list of symptoms, just as an example, and I'll say headache and fever, oops, and I don't know, some other really cool symptom that they have. And down here, I'm going to say that they can choose multiple of them. I'm just also going to put in a logical one and a checkbox just so you can see the difference between the two. So I go logical and a checkbox in here. Oops, and I'll call it checkbox to be super original. When you are finished editing your document, you do need to make sure you save it. And I'm just going to put my name at the end so I know it was me. And you would also be making sure you have it available for all your users to use. So I'll save that one. As far as using a template, people would come up and they would use a template. I'm just going to go and find that one. Because this is a referral, it's going to ask me who I'm sending it to or who I'm addressing it to. I'm just going to choose up here. I did not open this from a patient, so it's asking me who I'm talking about. These are those fields we put in. So here's my list, and I can pick multiple of them because I ticked the allow multiple. I'm going to tick both of these just so you can see what it looks like. So they'll both be ticked. Inserts all of that. And then there's my list, and there's the logical, which is a yes, it changes it to that word, or a tick box or checkbox, leaves it as a checkbox. But you can use them for things, all sorts of stuff. Like if you had more, like, I don't know, assessment questionnaires or things like that that people needed to fill in, you could sort of prompt them for those questions at the start. And then when they generate the document, it just goes ahead and puts them in the right location. There's a couple of messages through. Can you talk a little bit about e-signature? We don't technically have e-signature yet. Again, that is 100% an enhancement request that has been logged, and I will go and put another vote on it. The best that you can do, and you would need to weigh up the risk of this for your practice, would be that you could insert an image of a signature if you had that. So you could insert a picture and you could have a picture of a signature and you could do that if that's what you wanted to do. But we don't technically have an e-signature yet, but 100% it has been an enhancement request that's been logged. Erin, just want to read is there a way to bulk fix a broken hyperlink in templates? For example, when we converted from MD, all the date links broke. Is there a way to fix this? No, I don't have any really good, exciting answer to that. Because they're all individual templates, even though you're fixing the same field, you do need to go into each one to fix it, I'm afraid. Margaret, how do you set up pathology and radiology templates? What do you mean by that? If you can put that in the question, I'll come back. Joan, just going back to yours that I said I would come back to. Emailing from a patient file, why is it some file extensions not attachable, especially some PDFs work, but some don't? Some pathology results are attachable, some aren't. That's a good question as to which ones are okay to attach. I'd have to go and find a list if we have a list as such. But like cervical screening won't insert because of the way it comes into the software. And you're right, there's some other ones that won't let you add them as an investigation report because of how they come into the software. I don't have any great answer for that either, I'm afraid, except that I know that it's a work in progress, that they're making it a bit easier, hopefully, in next releases, but I don't have a time frame on that either. But I will go and add that, or I'll go put a little, yes, we would really like that in there. Sorry, I'm just going back and finding that so I can put that on my to-do list later. And what other questions do we have? Super quickly off topic, but is there any way we can import patients' medical records in PDF? I mean, you can import it into their like correspondence, but you can't import it as far as it will then be like a proper putting their medications in medications and things like that. But you could definitely have a new patient record and have their document and then attach it in like correspondence in. But that's sort of the only way to do that. Margaret, going back to yours, as far as when your pathology and radiology doesn't print in the right format, sort of. Pretty much the only option that you have in that is in preferences and in not so much pathology, but imaging. You can add a new layout in here. So, I mean, you just need to contact the lab itself and say, hey, it's not printing in the right spot. And then they will typically give you a layout to try, put it in here and see what happens essentially. But just have a chat to the specific lab and they should be able to help you with that one, Margaret. Yeah, cool. Export to PDF, yes, you can. I know that we're pretty much at time. I've got a few extra things that I will definitely cover, so we'll run a little bit over. I will quickly show you the subpoena tool after my few other bits and pieces. So I'm sorry if you've got somewhere to be. I'm not offended at all if you drop out. We'll just make sure that I cover everything that I said I would cover at the start of the session. So we've probably got another, I don't know, 10 or 15 if you can stay. If not, totally okay. The session's recorded, so you'll have that anyway. I think that's all the questions that were in there. If it's not, just put it back in and I'll read it a bit later. Sorry, starting not to be able to talk properly. Yes, you'll definitely get a copy of the recording after. Other things we wanted to have a look at super quickly, My Health Record, a couple of fields that you need to make sure that you have for that to work. One is in practice, well, there's two in practice details. One is in this, if you hit change up the top here, you've got your organisations health identifier here that you need to make sure is put in. You've also got, if you've got like multiple locations, you've got their individual health identifier as well. You will also need to make sure that the provider has their health identifier provider number in their user record, um, which actually that's a good segue. Let's go and talk about users. Beyond that, though, that should pretty much sort out your My Health record. If you have any issues with any of that, please just contact support. Um, okay, cool, sweet. As far as exporting to PDF, use the subpoena tool and then just choose PDF up the top. So we may not get to that. Users. In setup and users, this is all to do with adding users or modifying their permissions or marking them inactive if they leave, things like that. So we'll go through in here. I'm just going to pick up Dr. Ivacure here. Fairly basic information up the top here. You've got all their names. Category is important for a couple of reasons. One is obviously the doctor categories. We get this right side of all their clinical information that we have to put in, but also that category will give them a base level of permission, which we'll look at, but it at least gives you a starting point as to what they can and can't access in the software. You've got phone numbers in here. I've actually only recently learned that sometimes if you have a mobile number in here, it does get sent out on e-scripts. So if your providers are sending e-scripts, I have heard that sometimes it will also send their mobile from in here with that e-script, and they're getting calls from pharmacies and things, which is a little bit crazy. So I would probably say just don't put their mobile number in here and you don't have to worry about it. And the email address as well can also be sent out potentially in e-scripts and templates and things. Just put their work one. And even for mobile, if you had to put a work mobile in there or just leave it blank. With the providers on this right-hand side, you've got their provider number, which you can't type directly into, but in Location Manager, you can then double click on the location and then put their provider number in there. Prescriber, you can type in there, that's totally fine. This is their APRA registration number, and it's really only useful if that provider is wanting to use the real-time prescription monitoring, which is available in every state now, which is great, and it can be turned on per provider. So you can have some that want to use it and some don't. It's a user preference if they want to turn it on, but you do need to have their APRA registration number in here if they were wanting to use that. This is their health identifier for this provider. So we need that for My Health record, but also you would need that for them to be able to hook into ERX and send e-scripts as well. So they should know what that is. Just make sure you validate it. The other fields over here, full-time, part-time, just is the license that you're licensed for. So just make sure that they are right. Vocationally registered and DVA, local medical officer, if they are that, obviously tick that, it affects incentives and things like that. Has appointments, ultimately gives them a column in the appointment book. Has accounts means we can bill on their behalf. If you've got, I don't know the correct term, so I apologize in advance, but like contract/independent doctors, if you want to create a little bit more segregation for those, if you put their ABN and their business name in here, that is what will print on their invoices, not the practice's information. So potentially you can use that in there. The rest of that we probably wouldn't really use too much. Just going into permissions. This, if you have been in here before, you can probably appreciate this sorting A to Z, which has only been in Service Pack 2. It's, I don't know what order this is in. I can't really work out a logicalness of it, but that sorting A to Z has been incredibly helpful, but that's in Service Pack 2. All these permissions, though, I will send you through the knowledge base article because it is super well documented as to what each of these means. It is fairly logical to a degree in here, but I will send you the knowledge base article if you want to have a look. So this is based on that category. They will get sort of a baseline level of permission. But beyond that, you can go and granularly change this if you want to. So, maybe at your practice, you've got a receptionist that does a bit more than they typically have access to do, and you've obviously risk assessed that and everything's all good, so you come in here and give them that bit of extra access, or vice versa. Maybe they have too much to do their job and you kind of strip it back a little bit. You've got complete sort of control in here as to what you do and don't give people access to be able to do. Um, and it's sort of two things in here. One is either into a particular area of the software. So for example, just this top one here, user details is this whole screen that we're in. So, do we want them to even be able to view this information? And if we don't, we can change that they don't have any access whatsoever. Or you might sort of delegate user provisioning to a particular staff member. So you would give them access to add, edit, delete in that particular area. So either areas or functionality. So, prescribing on behalf of someone, sending an email on behalf of the practice, which is also a SOS Pack 2 edition. So whether they can send sort of emails out. I don't know, what else is a functionality in here? Overriding on the day appointments, double booking appointments, things like that. So it's either access to an area or functionality that they can do. The one probably in here that I just wanted to then sort of circle back a little bit to the start where we looked at reports. To set people access to reports is a two-step process. One is you have to give them access to the reporting module, which is in here. This is reports, and we would give them access. That's step one. The second step, so if we did nothing extra from here, that user would now be able to go to management and reports, but they would see nothing. So the second step is we would actually then give them access to individual reports to run. So in here, we've got some tick boxes. They're all those same reports. And this is sort of what I was alluding to a little bit at the start as well, that if you know those 12-ish reports that you are going to be running, you could just untick the ones you're never going to use just to kind of clean up your list a little bit if you wanted to. But in here, just sort of tick whichever ones that you do want to give them access to be able to run, and then they are the only ones that they will see when they go into management reports. If you were potentially going to give your doctor, say, this report, that work done by provider one that we looked at the start, just make sure that over on the right here that you are also giving them the correct practitioner access level. So, are we only giving them access to their own data, which is typically what you'd want. But if, say, you had like a principal doctor or owner or something like that, you would then be giving them access to everyone's data. So just make sure that's correct. If you have multiple locations as well, again, just make sure that you're only giving them enough to get what they need and sort of not additional information that's sort of not relevant to them. So if it's multiple locations, tick all of them. If they only work at the one, just leave it ticked at the one. And then basically save that, and then they will sort of instantly have access to those reports. The appointment types, as far as managing them, just in setup and configurations, they're in a little bit of a weird spot. But in lists in here, you've got these appointment types over here on the right. So the software comes preloaded with a certain list of appointments in here. Most of them, though, you can either get rid of if they're not going to be used, or you can potentially edit them and call them something else. So say, for example, we do not offer acupuncture at my practice here. So I'm just going to select that and remove it from my list. So it just means that now when my receptionists go to book an appointment, they do not see acupuncture as a appointment or an appointment type that they can choose from to book in, because it's not something that we offer. Pretty much all of these in here you can touch as far as editing or deleting, except for There's a few that you can't. So edit, you don't want to, sorry, internet here, you don't want to change that one because that is how the online booking systems hook in. So HotDoc, Health Engine, AutoMed, all of those. Leave that one alone. Long appointment as well is just 2 times a standard appointment. It's hard coded in there. Leave it alone. Can't touch it. Standard, you cannot change that either because it is just a standard appointment. Um, Recall is a recall. And again, it is hard coded in there. You can't get rid of it. And you can't edit it, mainly because there's obviously like a legal responsibility to give results back to patients, but it is a slightly higher level in the reception categories for people to be able to cancel recall appointments as well. All the rest of them, though, you can pretty much go for gold. Um, you can add new ones, give it a name, give it a length, give it a little picture. You can't add pictures, but again, that is an enhancement request. I'm not sure where that is in the roadmap, but there's a few different ones in here to choose from. I'm not sure particularly like a beer is really acceptable these days, but they're very old school icons. So choose whichever one you'd like to in there. Um, there's a fair few different tele ones, telephone, telehealth, teleconference. If you don't use all of those, just sort of get rid of the ones that you don't use. Or you can even change that default length as well to match up with what suits for you. Um, there are non-patient appointment types in here as well. So I think assist is one, drug rep is one, there's a meeting in here somewhere. There's meeting. There's other. There's maybe is one other non-appointment type. I can never remember all of them off the top of my head. But they are ones where when you book them in the appointment book, you don't have to allocate a patient to it. It will just let you save it as a non-patient appointment type. At the moment, you cannot add any new non-patient appointments. When you go add, they are simply patient appointments that you are adding. If you needed a different wording for a non-patient appointment, you have to just recycle one of those ones that's there. So, maybe this assist one, we would rename it to be whatever it is that you want, but you cannot add any new non-patient appointment types. Vicky just asked, is there a way that you can use 2 appointment types? I'm assuming you mean like when you're booking an appointment. And the answer to that would be no. Just on the note, as far as people who need an interpreter, um, I'll just open up a patient super briefly. There's a few extra fields in Service Pack 2. So I've got Service Pack 2 here, which is probably 2-ish months old now, give or take. There is these couple of extra fields. So you've got a country of birth, which is new, and obviously to help reporting and things like that. And you do have a preferred language. Oh, I don't know. I'll just pick the top one. And whether they need an interpreter. So whilst you can't book 2 types of appointments, you can only book one type of appointment. It will, at least you can record that. They are a couple of extra fields in Service Pack 2. Oh, cool, you haven't got it yet. Yeah, there was a few little hiccups with Tyro mostly in the integrations, but it's all full steam ahead. So maybe have a chat to IT about it. When an appointment type is cancelled, does the icon go back into the list? So that icon list is just the icon list. You can have multiple appointment types with the same picture. Not that you would want to, because that kind of defeats the point. But there's nothing stopping you from using the same icon for multiple things. So it's not like you take it off the list and it goes back into the list. It's just always an option there to choose from. If a patient has a tele appointment and then doctor call them in the afternoon, how can we do the billing? How do you mean, Shanaz? Can you give me a little bit more detail, please? And I'll circle back while you're typing that. I'm pretty much at the end, and I do apologize. I've run a little bit over, but I did want to make sure I covered everything that I said I would at the start. And I know we've had a few questions, which I think is fantastic. If anyone does have any last questions that you want to throw into the mix, please put them in the chat. I am just going to quickly sidebar whilst Shanaz, if you can answer, give me a bit more detail about that, I'll circle back. But we'll just super quickly have a look at the subpoena tool. Up in utilities, you've got subpoena tool. Obviously, you would pick a patient that you want to export information for. In here, you've got how you would be exporting that information. And potentially as well, this would even be how you could export your patients to go to another practice with BP. Because if you're going from BP to BP, you can import slash export an XML, and it will kind of be a bit more seamless as far as that, not just a PDF to upload. You could arguably even use the subpoena tool to do your data exports as well if you wanted to. But you would choose your format up here. If it was a proper subpoena, so to speak, like sending it to legal or work cover or something like that, come up here, you would typically be going a PDF. All the data types, dates to include. If it is work cover, they'll typically give you a date range, but otherwise choose all the dates. And then this is sort of all the information that gets included as part of that export, or putting it in the PDF. By default, it's just kind of everything. Hypothetically, if you didn't want, an on-screen comment to be part of it, you could untick that. Even going as far as like, maybe correspondence out, I'll just click on that select to see what's in there. Any of this, you can actually double click on and have a look and see what it is. And if that's not relevant to that export, you can actually just untick it and it will not be included in that PDF. So this does give you a bit more granular control as to what gets exported. And then when you're ready to go, just click export down here, wherever you want to put it. So I'll just put it on my desktop so I can find it. You do need to put your password in again. It's the same password that you log in with, and it'll go and work its magic, and it will put that PDF where we said to put it. So hopefully mine will show up on my desktop when it finishes thinking about it. This could potentially take a little bit of time. Like if you've got a patient who's been at the practice for many, many years, is a regular attender, has heaps of results, all that sort of jazz, that export will take a little bit of time. Don't stress too much about that. Just kind of let it sit and do its thing. And I'll just go back to and have a quick look at what it looks like. So there's that export. It's one PDF, and then you just need to work out how to get that to legal or work cover or wherever it's going. But it then just puts all of that information in that one document. There's all my visit notes. If we keep going down, all my results, and then it'll have all those documents and things that we've written after that as well. So it puts all of it one nice PDF and then give that to wherever it needs to go from there. Just circling back, so like in the morning, a small appointment, and then doctor calls to see them. Can we do 2 item numbers? I don't know. I mean, you would need to. I couldn't answer as far as a Medicare billing perspective goes. As far as if that was something that you could do according to Medicare, when that doctor opens up that patient again the second time in that day, it would ask them if they wanted to edit the note that they put in earlier that day. So actually, let me see if I can semi-demonstrate that. So I'll finalize this from before, and say I open Bonnie again. It should ask me, so I already have a visit. Do I want to edit that visit? They would probably be saying no if this is a separate consult as such. And then they would go and do whatever they need to do from there. When they finalize the second consult, and put in, whatever items that they're billing, it will just put that into the appointment book wherever we are. So Bonnie is here, and then so that hour and a half, because I accidentally left her open from before, that's that first note that I wrote as far as billing goes. That's the second time that I opened her up and then just finalized the visit. So if doctors are sort of just seeing people that aren't necessarily initiated from the appointment book, if they do open it up from the blue filing cabinet and they finalize it, it will then insert that patient into the appointment book so reception can do the billing for it. As far as whether you could bill those two things in the same day, I'll let you have a chat to Medicare about that. But functionality wise, if that was all okay, that would be how you could do it in the software. I'm so sorry, everyone. That's about 20 minutes over. Does anyone have any last minute questions, anything that you would like to put in the questions? Please feel free to do that now. I'll quickly answer them before we disappear. Thanks. I don't think we lost too many people in the extra time, so thank you so much for taking the time. I know your job is definitely not easy. I do not envy you whatsoever. Hopefully you found something helpful in the session. It is recorded. I'll send you a copy of the recording, and there's a few other bits and pieces that I'll put in, and a couple of enhancement requests I'll log for us as well. But also big shout out to Barb at the Eastern Melbourne PHN for organising it. I think it's an awesome thing to organise, just so that everyone's sort of on the same page. But if there's any other questions, I'll hang out probably for another minute or so. But really big thank you for taking the time. Shanaz, if I want to attend more this session, how do I know that? What do you mean? Sorry, as in, are they going to organise more sessions? That's a good question. I'm not sure. Yeah, I'm not sure. I know there was a little bit of talk with Barb. I would probably just have a chat to Barb at Eastern Melbourne and see if you've got like a list of topics. From my perspective, it's really easy for me to have a list and go through a list of questions or topics that you would find beneficial. And yeah, give that list to Barb and she can organise that with us, and we can rinse and repeat and cover all sorts of other things. Yeah, I think it's a great thing. But yeah, have a chat to them. I'm sure, I know that Barb's mentioned before. I don't know if Barb is still on the call. No, I don't think so. But I know that she said that it was definitely something that if there was interest and you had a list of things you wanted to talk about, that we could definitely organise some more. Um, but there's no more questions coming through, so thank you very much again. I'll get that recording and everything sent out. I'm going to be honest, it's not going to be today, but I'll definitely get that to you before the end of the week with that other helpful bits and pieces. But otherwise, have a lovely rest of your afternoon, rest of your week. Yeah, thanks very much for hanging out for a couple of hours of your time. So thanks everyone. Bye for now.